This is our assessment comparison analysis. I'm Catherine Blessing.
I'm Fiesha Donaldson.
I'm Lauren Goodman.
I'm Taylor Heath.
I'm Marin Kime.
And I'm Jamie Tasiopoulos.
The two assessments that we compared for this project were the VB map and the ABLES assessment. The VB map is also known as the Verbal Behavior Milestones Assessment and Placement Program, and it is an assessment tool used with individuals with autism spectrum disorder and other language delays. This assessment can be used by clinicians, educators, parents, assessment teams, and anyone who supports the child. This assessment is also based on B.F. Skinner's analysis of verbal behavior, established developmental milestones, and research from the field of behavior analysis. There are 5 components that are included within the VB map.
The VB map milestone assessment was created to help provide a sample of a child's existing verbal and related skills. It contains 170 measurable learning and language milestones that involve 3 developmental levels, 0 to 18 months, 18 to 30 months, and 30 to 48 months. Skills that are assessed are tact, echoic, interverbal, listener responding, manned, motor imitations, social play, independent play, and more. The VB map barriers assessment, according to Padilla and Akers 2021, focuses on both common learning and language acquisition barriers faced by children with ASD or other developmental disabilities, such as behavior problems and instructional control. Negative behaviors, escape, and avoidance of instructions, absent or weak manned repertoire, tax, and imitation skills can be targeted in this assessment. There are 5 levels to the Likert scale: 0, no problem; 1, occasional problem; 2, moderate problem; 3, persistent problem; and 4, severe problem. Being able to identify these behaviors can help professionals develop specific intervention strategies.
VB Map Transition Assessment. It can identify if a client is making sufficient progress and has maintained the appropriate skills for transitioning to a less restrictive environment. This tool can help have a measurable way for a child IEP team make choices to be able to meet the child's educational needs. VB Map Task Analysis and Skills Tracking, and VB Map Placement and IEP Goals. The study by Padilla and Akers 2021 states that this assessment goes hand in hand with the milestone assessment and provides an even further breakdown of the skills within the milestone assessment. According to Padilla and Akers 2021, the curriculum, placement, and IEP goals help practitioners develop and design an inclusive intervention plan and specific targets based on individual results.
The ABLES is the assessment of basic learning and language skills. Its primary purpose is to assess and identify skills in language and communication, as well as critical academic learning, self-help, and motor areas. ABLES are recommended for individuals ages birth to 12 years old. They consist of a comprehensive review of 544 skills from 25 skill areas. ABLES address a wide range of skills, such as learning readiness and the distinction between various language functions. The ABLES allows for optimization in communication, social interaction, and ongoing learning in everyday situations. There are some limitations that go along with ABLES. For instance, the visual scoring grid used within ABLES may be misleading in respect to scores that are looking to interpret progress. There's no data to suggest that scores can be added together in a way that is meaningful, specifically in respect to tracking overall progress. There's no published data in respect to validity or reliability. The assessment itself is notably long, and there is a lack of clear guidelines surrounding the use of reinforcement, which may lead to variability in the administration of the assessment.
ABLES measurement and data collection. So ABLES primarily utilizes a direct measurement system. Direct measurement systems can be understood as recording behavior as it occurs in either natural or contrived settings. Conversely, indirect measurement can be understood as when the target behavior is not directly observed and conclusions are drawn from other behaviors or environmental events. While indirect measurement systems can be beneficial, they are not the primary measurement system when using ABLES. So ABLES validity and reliability. Each skill has a maximum score that varies from one skill to the next, but the maximum score in any domain will either be a 2 or a 4. So for any skill with a maximum score of 2, the learner may score a 0, a 1, or a 2. For skills with a maximum score of 4, the child may score a 0, 1, 2, 3, or 4. From there, the data is then entered into the ABLES-R graph. So utility in selecting the ABLES assessment. So the ABLES covers many skill domains, including cooperation and reinforcer effectiveness, visual performance, receptive language imitation, vocal imitation, requesting, labeling, and interverbals. So these domains are imperative when working with younger individuals who have been diagnosed with autism.
So for our scenario, we have Charlie is a 4-year-old girl who was diagnosed with autism spectrum disorder, also known as ASD, when she was 2 years old. At the age of 3, she started receiving ABA services. However, her parents are unsure of where to begin with speech therapy and occupational therapy. Although Charlie encounters difficulties with some sounds, she manages to make approximations for several words. She has been allotted 35 hours of ABA per week, which she receives at an ABA clinic Monday through Friday from 9 a.m. to 3 p.m. Based on her presentation, ask yourself this question: what kind of assessment is best for Charlie and why? Although both assessments focus on language and communication, the VB-MAP has the Early Echoic Skills Assessment, also known as EESA. This assessment is used to evaluate an individual's ability to repeat speech sounds, such as phonemes, syllables, and intonation. The EESA includes 5 groups of items. Group 1, vowels and diphthongs. Groups 2 and 3, early consonants and 2 and 3 syllable combinations, respectively. And groups 4 and 5, prosodic features of speech, including pitch, loudness, and vowel duration. Charlie has the ability to make approximations with a variety of different words, but needs assistance with combinations of syllables to appropriately say the complete word. This is the main reason that the VB-MAP was chosen for Charlie's case. And our next slide is the references, and we hope you enjoyed our presentation.